Okay, does everyone see the title slide? Social innovation story? Great, okay, thank you for the thumbs up. Okay, okay, so again, today I'm going to be talking about my social innovation story in the space of mental health. This presentation was developed for the EDGEy conversations, so today, but I also had the pleasure of presenting it at the Eco-Commonings project led by Carla Leon, if you're familiar with Carla. Okay. So a little bit about myself. So my name is Tina Chan, and I got my Bachelor's of Science in Health Studies and Health Informatics, as well as my Master's of Science in Public Health and Health Systems in a human-computer interaction lab, both at the University of Waterloo. So I am a recent grad. I graduated last year, but I developed a social enterprise and have been operating it since my undergraduate career. So the enterprise is called Panic, Anxiety, and Stress Support Incorporated. PASS Inc. for short, and we develop straightforward mental health resources for schools and workplaces. So in my undergraduate career at the University of Waterloo, there was a problem that I saw, which was the, I guess, students' accessibility problems to mental health resources. So there were observed limitations, such as hesitations on getting human help due to long wait times. So for example, at my university at the time, which was 2015, it was about a 2-month wait time. It might have gotten better since, but I haven't heard the positive stories yet, unfortunately. There's also intimidating hotlines with a focus on crisis and suicide, which kind of like scared away students who didn't really see the need for accessing crisis or suicide support. And also students had individual reasons why they chose not to seek formal help. So for example, they might experience self-stigma, which is thinking that it's kind of weird or kind of odd for them to access support, and that accessing support might make them look like incompetent students in the academic community. And also a lack of information, so not knowing what resources are available on campus. So there are also limitations on the current resources, not only the hesitancy to access the resources. So resources, for one, need to be sought out voluntarily by someone with existing interest in mental health. And these resources are often text-heavy and not super useful in a situated moment of panic. For example, if a student came in from high school, top A student, and they felt that they're not really susceptible to stress, which is untrue, and they felt like they aren't really part of the mental health conversation or don't need it, they're less likely to seek support, even if they feel like they needed it. And also a lot of the support that they got, so for example, in pamphlets or just like web materials, they kind of describe what exactly is mental illness, what exactly is mental health, and what you can do to prevent it, but it's not really usable when you're going through a panic attack. So one thing to note is that long-term solutions to mental health issues do require a systematic advancement, such as policy change. But I personally want to develop resources that were effective for in-the-moment, non-severe panic, anxiety, and stress. So while we wait for those really good people to like make these policy changes and make sure that all the resources were accessible to all the people, I want to make something to kind of like bridge that gap for these people waiting on these changes to happen. So in short, we want to develop resources for those in the gap between the onset of symptoms and support. So this led me to ask the question in my undergraduate career, where is the first aid kit for mental health? So this was in 2015. So first aid kits don't necessarily replace doctors. Actually, they don't replace doctors at all, but they're always found in preparation for trauma. So like in the classroom, in the workplace, and maybe at the sports rec facility. And they're always provided by the community. So I pitched the idea of a first aid kit for mental health at St. Paul's University College, which is a college part of the University of Waterloo, and was rewarded an opportunity along with my peers in a program to develop the idea. So the program was called, the pitch competition was called Big Ideas Challenge, and the opportunity was called the Social Impact Fellowship. So this was an incubator program. So I was living in a community with like-minded individuals, and we together would think up solutions using the business model to, I guess, help the community as we saw it. So this was the proof of concept that I entered with. So the kit had earplugs and a sleeping mask to block out noise and light, a squeezable and chewing gum for focus and muscle relaxation, And in the end, I called it the PASS kit. So it stands for Panic, Anxiety, and Stress Support, which would become the namesake of the company. So originally, there was a bright lime case and hand wipes. I think they're called moist wipes at the time, the brand, which provide tactile sensations, which was borrowed from the, I guess, autism parenting community. But as we interviewed students in this, I guess, design process, the students really did not like the look at me aspect of the case. So like the lime green, we thought would be like attracting awareness to the mental health conversation and inviting conversation, but students really didn't like it. They really, I guess, wasn't in the place culturally to, I guess, stand out and say, I'm an advocate for mental health. And we soon learned that not every student encountering a mental health concern was a mental health advocate or wanted to be an advocate, wanted to be a mental health advocate, and we need to respect that. They also did not understand the wipes without instruction, so we removed it. Okay, so next we conducted a study with the PASS kits among all St. Paul's University students, and we used a less eye-catching case. And we also incorporated these flashcards to offer quick reminders based on advice with counselors supporting us to share relaxation techniques. So this whole study was part of my undergraduate thesis. We found that half the students were still using it after the exams when we distributed during midterms. So this would be still using it in December when we distribute it in October. And some students reported that it actually deterred cases of self-harm and also sparked discussion with roommates. One interesting finding was that DONs, so residential community leaders who were usually upper year students, found that it was a really good conversation tool to just introduce to, I guess, the students living in the residential community at the time. And it was kind of like a tool just to like grease the conversation to make mental health easier to approach. The cards were based off a concept called cognitive behavioral therapy. So CBT, it's this acronym, and it comes from the idea where it's okay to critique the, I guess, like the automated thoughts that we have. So for example, if you are feeling really, really stressed out and you can't study, maybe it's not because you're a bad student. Maybe it's because you haven't drank water in the last 6 hours, or maybe you haven't rested your eyes from the screen. So these cards, which we later call the reminder cards, were just there to remind students of what they already know. So we began to experiment with product design. So we evaluated costs of each material and also distributed products outside of the school community into community workshops on mental health. So I think this was a workshop hosted by the House of Friendship. And in this case, we decided to use these pillow boxes to give like a less kit-like homemade feel and more like gift-like. So it was more like, here's a care package for your workshop attendees. Unfortunately, the pillowcases, although they were unexpectedly popular, didn't really work when we wanted to ship out the kits. So like shipping to like other cities who were interested in our product, etc. So we eventually settled on square shippable containers, which would ship in flat, and then we could ship out stacked as we had more interest from customers outside of our city. But as more people outside of our network shared the PASS kits, the more we found that the kits needed instructions for use. So it was no longer just like students who knew me as Tina Chan, and asking about what I was doing, or like professors asking me like, can we get these kits? It was people who saw our kit in like local media and wanted it for their community. So this is what it looks like today. We have an instructional insert at the bottom of the kit explaining what each item does. And we were also able to secure a partnership with a Canadian brand, Pure Gum. So you might have remembered them from Dragon's Den in like 2013 or 2014, but we were able to like speak with them in 2016, and they gave us like a really good partnership opportunity. So we also updated the entire look of the package to be more attractive and less like a medical package, so less like a first aid kit and more like something that you would see on the shelves. I think the like designy attractiveness aspect to it also kind of stressed our idea that we're not treatment, but only a tool to build mental health literacy in that moment. So we were a gap product. We're not formal treatment. We're just to kind of be there to build the confidence or allow students to reassess what they're experiencing and see if they want to seek formal treatment. We also updated our cards to be more attractive, but also more organized, as we were difficult to navigate without the images. So we have color-coded categories. So like the red category goes with your body. And then I think there's another category here called your mind. It's a little covered up. But then we also have a relationships category and a lifestyles category, as well as one category about emotions. So everything was just more easy to see and navigate in that moment of panic. Everything in our cards we designed to be easily comprehensible. So when you are experiencing stress symptoms, your mind cognitively is not like working at its max. So we try to make it easy, and everything's referenced. As our sales increased and production became a larger problem, we came into contact with EDGEy Rehabilitation, a center for adults with learning difficulties. And we were able to use their space and hire persons with disabilities to work at full Ontario minimum wage in 2017 to put together our kits. They're very generous in allowing us to be operating out of their space, but also using their space for storage. So that year we delivered 7,100 kits to an orientation week at the University of Waterloo. And everyone got one, not just those who identify with mental health concerns. So it was a really great opportunity for the U Waterloo community to prepare their students for stressors in midterms or even exams. We also expanded outside of the student community and selling to intersector groups all across North America. We also got some media attention, which was really fun. And I got invited to deliver a TED Talk about social entrepreneurship, which was very, very fun to an audience of students. So in summary, since our conception, pass kits have been used for different purposes for different users in different languages. However, we found a need for specificity above usability. So there are emerging mental health concerns that require different approaches, such as screen time overuse, as well as eco-grief, which we developed with support with the Social Innovation Challenge. So eco-grief, as some of you know, is the feeling of loss and helplessness due to climate change. It was a very new and complex topic for us, but it impacts a lot of youth. At the event, I specifically remember a woman telling us that her grandchild was envious of her for the luxury of having a natural death, which really solidified the importance of the topic for me personally, and also us as a company. So here are some pictures from the Social Innovation Challenge. So me pitching at the event. And what was really great about the EDGEy network was that we were able to be connected with educated mentors on the subject, from authors, activists to psychiatrists, and providing us with funding to hire 2 co-op students to develop the product, and more out of the Conrad Grebel Center for Peace Advancement. So that's Kasturi and Abby, and they were really great help. So currently we have developed a flashcard set specific to eco-grief, and it's up on sale on our site. But we are also organizing some feedback and tests with environmental groups locally, as well as in the United States come September. So moving forward, we are going to be developing products on different topics as well, but also adapting our current products for different audiences by request. So for example, elementary schools, parents, patients, etc. We're very thankful for the community support that's helped us lessen our constraints in our journey, such as St. Paul's, Conrad Grebel, and the Social Innovation Challenge, among others. So here we have a map of customers between 2017 to 2019 to just give you a snapshot of our customers and how worldwide they are. So the green ones are the individual customers, and the red ones are corporate customers, including schools and healthcare facilities. So a little takeaway that I like to say is, oh, it glitched. But it says, it's supposed to say innovate passionately and implement consciously. So this is something that I like to live by. So even though we have a lot of ideas and we think that we can help a lot of people, it's always nice to get feedback and support from the community to make sure like all the wild, passionate ideas that you have will help people. Here is where I can be contacted at, and here is our website and where you can sign up for our newsletter. Okay, thank you.